everybody for coming in and joining us today. Hopefully this will be pretty informative and quick and useful. Just quick rundown of the agenda. I have a few TFM announcements to make, and then Elaine from the tobacco section is going to give us an update on the CDC grant that they just recently got. And then I'll give an update on the legislation that's going on at the Capitol for those of you that were at the annual conference, sort of a follow-up from what Jared was speaking about. And then finally, just a couple closing comments and a chance for everybody to share what you guys are doing around the state. So without further ado, I'll get started here. So first off is, okay, there we go. I don't know if you didn't see the update that I sent out last time. It announced the TFM mini grants are now available. We do these every year. They're intended for smaller projects, sort of pilot type projects that either are hard to fund or aren't worth going through the time and hassle for a larger grant and all the paperwork associated with that. So we try to make these really easy. Most of the grants are in the $500 to $1,500 range. We have about $5,000 to give out total this year. The idea is to focus on projects that involve youth or increase the awareness of ENDS products, or that can serve as pilots. Some of last year's examples included developing toolkits for schools, doing some vaping billboards, a really cool project done by the Muskegon folks to work with some of their students to put together PSAs to play at local theaters before some of the blockbuster Marvel movies and DC movies. Working on presentations for schools, getting a vape patrol that's where kids can report other kids smoking in exchange for some sort of reward. I don't know the exact details. Or there was last year's project that was a really great idea, but didn't turn out so well. That was a trunk or treat style event. If you remember, last Halloween was super cold and rainy and miserable, and they had a number of people out there and had really great interactions with people, but it was just such a miserable night that I feel horrible for those for that health department that did that. So those are just some ideas. That these are not things you have to try to repeat or whatever. We're really looking for sort of the novel ideas to get you out there and try to do something new. We try to keep these relatively low paperwork so that, because the focus should be on getting the results, not on our papers. Applications are available now. You can get them off of our website at tobaccofreemichigan.org. They're due by the middle of August, at which point our outreach committee will review them and make the rewards. And then all we ask is that by the end of the year, you submit a little report. Form is not actually attached to this PowerPoint, but it is attached to the application. That gives us an update of what you did so that we can share it with others. Also, just a heads up, TFM operates a membership year starting every October. That means our renewals are going to be going out in August. Given COVID and how everybody's working from home, I know there's a lot of issues with people getting mail, especially at work. So I just want to give everybody a heads up that to look out for these and try to make sure that when it does come through, you get it flagged and we can get your membership back up to date. I would also strongly encourage everybody to consider joining as an individual member. It really helps us when we're talking with decision makers and policy makers to be able to show support from both organizations and members. And although I probably don't need to, some of the benefits of membership are, we have the TFM update that goes out twice a month. TFM really does serve to promote strong tobacco policy so that you guys can actually do the good work on the ground. You get a discount to the annual conference, which hopefully we will have in person again next year, because these virtual meetings are great, but there's nothing like seeing everybody in person. And as a member-driven organization, you guys really do shape the direction that TFM goes. And then my final announcement is our board of directors. We elect new board members every year, and that is going to be coming up as well. So if you're interested in joining the board, please think about it. We will be getting out further announcements and act formal nominations later in August. But just a quick rundown of what the board does so that as you're thinking about it, you know. Board members are expected to attend quarterly meetings and take part in a monthly conference call. Typically, you spend about 2 to 3 hours a month on TFM activities, either attending meetings or serving as an ambassador for TFM to your local networks, whether they're geographic, social, or professional. And as a director, you really do help shape our programs and activities. So that is everything that I have. If anybody has any questions about any of those things, I will be happy to answer them. Otherwise, I'm going to turn it over to Elaine for her main presentation.
Thanks, Paul. I am just going to bring up my slideshow here. I hope everybody's doing well. It certainly has been a crazy time. And thank you everybody for taking time out of your day to attend. So yes, Paul announced earlier that thankfully the Tobacco Control Program did receive a new 5-year tobacco grant from the Centers for Disease Control. So we received most of our money from the Centers for Disease Control. We also do get some state funding as well. Now we know with the state budget right now, it looks like this year they balanced the budget. Next year is not looking good right now, but we'll see what they come up with. So I will tell you that we did sustain a cut this year from the CDC. I don't recall the actual amount. It was fairly significant. So we'll continue to fund the contractors that have been part of the request for proposal that we got out last year. So some of the contractors we've been working with will be in year 2 of this 3-year time frame for which they applied. We have a few contractors who are in year 3 of a grant funding cycle. And so to my knowledge at this point, even though we sustained a funding cut, we still will be working with the partners who have been funded through the original request for proposal. So I don't want anybody to get really nervous about that. Our goal has always been to put a lot of money into the community. So, you know, we're going to be juggling some things around this year and trying to figure out where we need to put some new money, because there were some new requirements that came out as part of the actual grant application. So there are going to be some things we must do that are new and I think are going to be really good additions to the program. And I'm going to talk about those in just a minute here. But suffice it to say, we received the 5-year grant funding. It'll carry us through year 2026. So that is really good. We're really pleased that we did end up getting something. Let's see here. Sorry, I'm not sure why I'm not able to advance. There we go. Okay, so for as long as I can remember, and I've been in the tobacco section since 2006, The Centers for Disease Control comes up with something called their CDC best practices. A lot of you have probably heard about this. It's kind of time and tested strategies and activities that have gone through a lot of data and have been tried and tested, I guess I would say. And so these evidence-based practices are really what guide our work. And for as long as I can remember, there are basically 4 National Tobacco Control Program goals, which you see here. So we're always working on preventing the initiation of commercial tobacco use among youth and young adults. And I say commercial because there is the sacred use of tobacco as well, which is not what we're talking about. We're talking about the commercial tobacco use. We always work on eliminating exposure to secondhand smoke, and now with the advent of e-cigarettes, we've added aerosol to that as well, because there are a lot of effects from secondhand and thirdhand aerosol, as well as secondhand smoke and thirdhand smoke. We're always about promoting quitting, and there has been also, and I would say there is some increased attention being given to identifying and eliminating tobacco-related disparities. So we've always been about eliminating disparities. So there are many population groups that are very adversely affected by tobacco use. And a lot of it is historical trauma, discrimination, stigma, various things that contribute to the use of tobacco use, and is sadly as follows that, often tobacco-related disease and death. So we really want to try to move the mark in the communities that are most disparately affected. We want to move the mark in every community, but we're really going after those that have the highest tobacco use rates. I mentioned that the grant is for 5 years, and it is a greater emphasis on health equity. We're going to be doing more health systems change. We're already working on that. By health systems change, I mean actually working with clinics, hospital systems, and that kind of thing, to get physicians and healthcare workers to always ask about tobacco use when they see a patient, to always advise the patient to quit, to assess, to follow up with the patient. The 5 A's is what I'm referring to. And there's going to be a really, I would say, not a renewed emphasis, but an increased emphasis on youth and young adult initiatives as well. These were some of the things that came out of the requirements for this grant. And there are a couple other things too, which I'll tell you in a minute. So when we applied for the grant, we essentially saw that the CDC was looking to have us respond to 2 main components. And the first part of it is called state and community interventions. The second part of it is about improving quitline infrastructure. And I'm going to break those down just a little bit for you. Excuse me. So let's first talk about the state and community interventions. This year, there were a number of requirements in this particular component of the CDC grant. There's a statewide disparities requirement, there's a community-based disparities requirement, and a youth and young adult requirement. And I'm going to talk about each of these individually so you can get a better idea of what we're thinking about. So the statewide disparities requirement, they are asking us to work and focus on behavioral health and to engage the community, the behavioral health community. And what we want to do here, obviously, is to address tobacco use. We know that people who are living with mental health issues, for example, are using tobacco at much, much higher rates. And so we have people with disabilities in the same position using tobacco at much higher rates. And so this is a group that we've tried to target over the years, but I will say this is going to be a very renewed and very increased emphasis on working with behavioral health communities. There's actually a community of practice that has been operating for the last year or so. I am not involved in that personally, but Julia Hitchingham, our section leader, is. And so they've already started this work, and this will be so reaching out to behavioral health agencies, trying to get them to look at tobacco-free policies on the grounds. It could be education of providers around all the disparities that exist within the behavioral health community. And there's going to be some more time and effort given to quit tobacco services. I'll address that a little bit later, but essentially what I'm talking about here is we're going to be working at the Quit Line with a much better protocol, I would say, for people who call in or use the online services for the Quit Line. So it'll be a behavioral health focused protocol, I guess I would say. Some of you know we have various protocols and we have various languages that are used on the Quit Line. This is going to be an additional and much better, I think, way of dealing with folks who have behavioral health issues and who are interested in quitting. So this is one of the major requirements that came out as part of this grant. The second requirement that came out of this grant is the community-based disparities requirement. And
can we ask questions now, or would you rather wait?
Makes no difference to me. Paul, do you have a preference on how you want to handle it?
No, if you're comfortable taking questions now.
Sure. Yeah, go right ahead. I'm not sure who was asking, but.
This is John Kronick.
Hi, John.
Hi. You're talking about behavioral health. Are you talking about substance abuse services? Are you
Yes.
talking about, you're not talking about mental health, you're talking about substance abuse, okay?
We're talking about a lot of things. Well, we are including that in this, I will say. The other thing that we're thinking about too is working with the child and adolescent health centers, because a lot of the kids who come through those programs, through the either school-based system or non-school-based system, it gets a little complicated. A lot of those kids have issues around mental health and substance use. And so it is possible that we will be working with a couple of the adolescent child and health centers too, to really hone in on this population that comes through those centers. So it's a large requirement. We will have to pare it back. I don't know exactly how it's going to look yet, but I do know, as an example, that this community of practice that I was referring to earlier, a lot of our work has been done with the Office of Recovery Oriented Systems of Care, ORAS, which is a state-level agency which deals with substance. So I can say for sure that we are already working with them and will continue to be working with them as part of this requirement. I hope that answers your question.
It does. And the second question I have is maybe beyond what but since you're from the state, with the Michigan Prevention Association, we're an advocacy group. And what we're finding is advocacy, which is public related policies, right? There are a lot of agencies out here that are like, no, we're not going to do lobbying. And they're just afraid of lobbying. So when we start talking about tobacco related policies, I'm afraid we're going to run into some walls because people don't want to put themselves at risk by doing lobbying. Do you have guidelines that you offer the people you work with, the agencies and so forth, to distinguish between those two?
Yes, thank you. That's a really good question. And we definitely do not want to ask anybody to lobby. That is against what we're able to do and what many agencies are allowed to do. So there's a huge difference between advocacy and lobbying, as we know. Advocacy around a specific set of bills, which I know Paul is going to be talking about a little bit later. There are several bills that exist right now in our legislature that we are asking people to advocate and educate around. So, for instance, when you're talking about a set of bills, you don't want to say, Senator or Representative, I want you to vote this way on a particular bill. What we're offering are
and I understand the difference
Mm-hmm.
that we're looking at. I'm wondering if you have guidelines or a document that says, here's what we approve for your agency to be engaged with.
Yes. In fact, Paul has come out with, or maybe as a part of an alliance, a statewide alliance that's working, there are a set of talking points around these bills that I'm referring to. And so talking points in those documents the agencies can use to educate legislators and others who are decision makers on these particular bills is the thing you would want to do, because you don't want to refer to the bills, you want to educate on policy that is tied to the bills, but you don't want to name the bills or ask for a vote in a certain way. You simply want to educate. And I think using these talking point documents that Tobacco Free Michigan and, for instance, the Keep My Kids Tobacco Free statewide alliances come up with are a really good place to start.
Okay, so Michigan Prevention Association will be trying to put together some guidelines that given anything that comes up, an agency will feel comfortable in following education so if you have any, not just specific talking points around anything, but a general document, then we'd be interested in seeing that and incorporating it.
I know that, and Paul, you can comment as well. A lot of the documents that come out are drawn up, if you will, by Tobacco Free Michigan as a member of this statewide alliance. And Paul, you might be able to speak a little bit better on that than I can. Do you want to say anything about that?
Yeah, it's yeah, I think that's accurate. Is what we put out is just sort of information that people can then use. But John, I think I'd be happy to address your more broader point of trying to come up with sort of clarity as to what is advocacy, what is education, and what is lobbying. Because that sounds like what you're looking for. I've got a few resources as to what that is, and maybe later we can set up a time to get together and talk about those to help you come up with your guidelines more
Sounds
broadly.
good. Appreciate that.
And John, thank you for raising that point, because you're doing exactly what we hope advocates will do. We need people to speak out and talk on behalf of your communities with whom you're working, or if you're a member of a certain community that's disparately affected, we need those voices. It's super important. And I know several years ago, just as an example, there was a statewide group called the Michigan Multicultural Network. They're not in existence the way they used to be. There are still many agencies out there that were part of the MCN who are still doing advocacy work. But what I will say is that these folks who are in this group, the real benefit, the real strength that that group had was that they represented various communities that were disparately affected. They came together and actually would go as a group, as a matter of fact, to educate legislators on various topics around tobacco. And it was an amazing thing to watch. I was actually able to be present a couple times. And so when you see the power of different communities coming together who have those voices and have those stories to relate to people who are making decisions on tobacco, and you know, these folks can tell how it affects their communities, it is extremely powerful. And so thank you for bringing that up, because we really want people to be advocates for these policies. Okay, so another requirement is the community-based disparities requirement. And so in this situation, we're going to be working specifically with the African American community here in Michigan. They are one of the groups who are very disparately affected by tobacco use. They have been targeted for, like a lot of groups, for many, 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 many years. And so there are going to be 2 lead agencies. Right now, we think they will be working in 2 regions of the state, the Southeast Michigan area and in West Michigan. And the goal of these organizations will be to build, there are already coalitions existing in both areas, but they'll be building the coalition's knowledge around tobacco use and why it exists, the disparity exists in the African American community. And they're actually going to be choosing a specific policy goal. It could be, you know, banning menthol products. It could be prohibiting retailers from operating within a mile of schools. It could be a variety of different things, but we're going to be working with them to select a specific policy that will most benefit their community, and using that community voice, or the voice of the community, to elevate that policy with local decision makers and try to get some policies passed. So this will be very exciting. It's going to be a lot of work. The agencies with whom we'll work, and I don't I can't name anybody specifically, as I couldn't really name at this point the community-based behavioral agencies, because we're still trying to figure this all out. But the agencies with whom we work will be operating on a 5-year work plan. So similar to what we see here with the Centers for Disease Control, this 5-year cycle will also be a 5-year cycle for these agencies as they try to work on this policy issue. Okay, continuing on with the community-based disparities requirement, there are a number of other minority serving populations that are disparately affected, have high tobacco use rates. And you can see some of those listed here. People living with HIV, the Native American community, Arab Chaldean, the LGBT community, veterans. There are a number, and I'm surely not naming them all, but we always are doing work within various communities, and specifically a lot of these communities because they are the hardest hit. So when I mentioned earlier that we have contracts with a number of agencies, this is where some of the community-based work will happen, that continued funding of agencies who work with the Native American community, who work with the LGBT, people with HIV, living with HIV, and so on and so forth. That's where we're going to see some of this continuation of the community-based disparities work. The other thing that we're going to see is a lot more focus on tobacco-free policies. So we're moving from, we've always worked on policy, but we are really trying to achieve good, sound policy. Education is important when you're educating on policy, but we are really going for these policies in multi-unit housing. So if you have, for instance, a private landlord who has 12, 20 units, whatever, in an apartment complex, we're going to be working with them, and or our contractors are going to be working with them to try to get them to adopt tobacco-free campus-wide multi-unit housing. We're going to be working on tobacco-free parks and beaches, adopting LGBT pride events as tobacco-free events. So these are just some examples, but there are probably many more. And in fact, I know there are many more. But anyway, just wanted to give you an idea of kind of what some of the community work is going to look like. And then, of course, the third requirement, which we've been working on intently over the last about 2 years, especially as it relates to e-cigarettes, is going to be continued in this CDC 5-year cycle. So we're going to be focusing a lot, as we have been, on the youth and young adult initiation and use of e-cigarettes. We've been doing some train the trainers around the state. We've been doing statewide work group calls every month. A lot of our folks whom we work, they have youth in their organizations that attend and organize advocacy days around tobacco-free youth and that kind of thing. The other thing that you're probably going to see is an increase in the number of indoor air policies, which include e-cigarettes. We're really going to be stressing the My Life, My Quit protocol for teens. And then we're going to be looking still, this will be interesting to see if this one will continue to go. We've had a lot of schools who have adopted 24/7 campus-wide policies, both high schools, middle schools, as well as college campuses. With COVID, there's been a big slowdown in our ability to work with some of these folks, but we're still going to be pushing for those, especially in light of COVID and the link to smoking and vaping, and how if somebody uses tobacco, specifically combustible or the e-cigarettes, it can exacerbate a COVID-related illness, and it's already doing lung damage to a person. So they're much more susceptible to getting COVID and or having some bad results in terms of if they get the virus and trying to get through it, trying to get over it. So we've always as well had mass reach health communications, which have been a part of what we do. And it's not something that you would certainly see, but it's not necessarily something that you're always aware of. So for instance,
what time can I call you back?
I'm hearing some feedback. Okay, thank you. I'm not sure, I don't know what that was, but anyway, so we're really going to be working this year, hopefully, on developing very culturally appropriate, high impact messages that are really going to use, again, the voice of communities. So going into some of these communities, getting their opinions on what kinds of things, messages, images will resonate with them, and then doing some high impact messaging. It could be billboards, it could be on TV. We just don't know yet. But I do want to let you know that there is going to be an increased call, I guess I would say, for mass reach health communications. And this has always been something we've done. And it's really important that when you're working on policy and you're working on this tobacco related stuff, that you have the policy work, the community-based work, the education going on along with media and messaging, because they build on one another and work together. They're kind of like, for lack of a better word, synergistic, to help build the momentum around tobacco policy and why it's important. So the other thing that's part of this state and community interventions component that I was mentioning is the health systems change. And as I mentioned at the beginning of this, really getting folks, in particular physicians, healthcare workers, healthcare professionals, even people who are working in organizations that do general intake when a client comes in to use the services of an organization, really starting to get people to include tobacco use screening, referral to the quit line as a method of just general business practice. And then we are going to be expanding the reach, and we're going to be promoting the use of quit support services. And I'm going to talk about that a little bit more as we get into the component 2 here in just a second. Surveillance is always something we do too, and often I think it goes unnoticed, but it's an extremely important piece of what we do. It informs us. Surveillance is about getting data and trying to get that data to inform what strategic direction we go. So for instance, these are a couple examples of what we're doing. Some of them are already in the works. For instance, the tobacco survey that you see listed here. We have never done a survey of the African American community in Michigan. This will be the first ever that has been done. We are going to be, of course, updating various data points as we get them from statewide assessments, national assessments. So we have a team of people in-house, epidemiologists, Dr. Shamo, Sean Bennett, a number of other folks on our team who look at this data and really try to crunch it for us so that we can see where the most need is and what the most important public policy ought to be, if you will. So now let's talk a little bit about component 2 of this particular application. So we just got done talking about the state, state and community interventions. Now let's talk just for a minute about the improved quit line infrastructure. A couple of things that are going to happen this year. I mentioned earlier about the behavioral health component being a requirement this year. And as such, we're going to be developing and testing a behavioral health quit protocol for the quit line. So for instance, a lot of you who are familiar with the quit line know that we have a pregnancy protocol for people who are pregnant and after they deliver the baby. There's a specific protocol that they would use. And so somewhat similar to that, I mean, this will be a protocol that will be applicable to the behavioral health, the folks who come in with behavioral health issues. And our goal here is to have trained coaches who work specifically with behavioral health clients to try to move them along the quit process. We're going to be trying to improve quit services for the 18 to 24-year-old group. We've done a lot around My Life, My Quit to help those under 18, but we still see a lot of tobacco use, especially e-cigarette use, cigar use in this 18 to 24-year range. So we're really going to try to be beefing up more of a protocol. Again, I don't know if I'm using exactly the right word, but services that cater to that age group. And then, as you know, you probably are familiar with the TIPS campaign that the Centers for Disease Control runs. They're going to be ramping up that, and we always see a big surge in quit line use when the TIPS campaign is going on. So it's just going to be making sure that we have enough coaches who are available during those national media campaign times so that we can accommodate people and not have people on hold, not have to call people back and that kind of thing, although that could still happen. But just making sure we have enough staff. You'll probably be very happy to know that it is our intent to fund Tobacco-Free Michigan. It'll be through state dollars most likely. And I mentioned to Paul at the beginning of this call that I didn't tell him about the budget being worked out, but I'll be able to discuss that with you more, Paul, in just a couple hours. And we'll be announcing some new partners as it relates to not Tobacco-Free Michigan, but the work I was just talking about for our 5-year grant application. We'll be announcing partners who are going to be working on behavioral health, who will be working in the African-American community, and so on and so forth. So there will be some new partners coming to the table. We're always glad for that. And we have a lot of work to do. We are in the process of trying to hire. We really wanted to add a couple staff members with this application. Sadly, because of the cut, we will not be able to do so. We still have one position we're trying to fill, a policy position on the staff. So we are going to be rather short-staffed with a lot more work on our plates with less money. I'm sure all of you are familiar with this. We're all kind of in the same position. So that about does it for me. I don't know if folks have other questions, but that in a nutshell is the 5-year Centers for Disease Control grant. We look forward to working with all of you. And of course, even if you're not a funded agency or partner, you know, we're here to help anyone and everyone in Michigan with policy and resources and materials and that kind of thing. Are there any questions?
Elaine, I've got a question that you probably can't answer. Everything you've said sounds really good and really important. And I know it's, as you said, it's things that you've been trying to work on for a number of years. But given the cut in the grant that came through, anticipated cuts from the state, do you have any sense of what is going to get lost in order to get some of these things accomplished?
You're right, I cannot answer that.
Okay.
It's something that I'm thinking about all the time. We're already thinking about that. I don't know. I don't know the answer to that. And I know that our financial person has been working literally way over time trying to figure this out, because we really don't want to cut partner funding. And I don't think we're going to have to. I don't want anybody to misunderstand that. I don't think we're going to have to. But, you know, one of the things, sadly, that always goes is this commitment to mass health communications, mass reach health communications. So, you know, we might have to find a different way to budget for communications because we want to keep the money in the community. But yet we have to have good communication too. So sadly, that seems to be one of the areas that always gets hit and gets cut because we don't want to cut partner contracts. So, you know, I'm not saying that will happen this year. I don't know. I think, you know, our financial person, along with Julia, our section manager, will be the ones who will have to make some of those tough decisions. And I don't know what those are at the moment. But you're right. We're going to have to give and take some things. I mean, it's already pretty insane in our area. And it's, I think, going to get more so.
Something to look forward to.
Thank you so much for having me.
Oh, no problem. Thank you. Anybody else have any questions for Elaine?
I have a question. Hi, Elaine. It's Cliff.
Hi, Cliff.
Douglas.
How
How are
you
you? It's great
Good.
to
How are
see you.
You
I'm
too.
fine. Thank you. All things considered, as is true of all of us. You know, you mentioned COVID earlier, of course. Everything we talk about has to do with COVID. I'm serving on a working group with the North American Quitline Consortium, who are looking at the quitline intake process and in the process of helping people through figuring out what their issues and concerns are and what's going to be most effective to help them quit smoking or using other tobacco products. And we're looking right now at the potential addition, a little inside baseball, of adding a carefully selected, targeted set of questions related to COVID and folks' concerns about COVID, and trying to get at whether that's motivating people to quit, whether it's raising their fear about the impact that their tobacco use might have on them because of the relationship that we know smoking in particular has to COVID-related risks. And just wondered if there's anything that you might be aware of related to what may be done in that area related to, quitline intake and treatment here in Michigan.
That is a great question and a great thought. And I have to be truthful with you, I hadn't even thought about that. We think about COVID and smoking and e-cigarettes all the time, but in relation to the quitline, I don't think my colleague Karen Brown is on the call today, although I'm not sure. Paul, maybe you can tell me. Karen manages the quitline, and I know she works with the quitline consortium as well. I would be willing to bet that she has information or knows of something, and I'm willing most definitely to talk with her. And because now I'm really interested, now that you brought it up, I'm really interested to see if this would be part of the new protocol and some of the intake questions for the quitline. So let me say this, I will go back and ask and see if there's anything floating around out there of which I'm not aware, and I will share it with you, Paul, and then if you can pass it along, if I can find anything out, that is, and I will pass it along to you, Paul, who maybe could pass it to the membership.
I will absolutely do that. Yeah.
Yeah, that's a great question, Cliff. I thank you so much for raising that.
Oh, yeah, of course. And it may be a little bit premature. I think that all around the country, the different quit lines in all of the states are thinking through these issues right now. So it may be that it's in deliberation, and I might have asked the question a few weeks early, but
yeah,
I thought I'd check in about it.
Yeah, no, I think we have to. We do need to be thinking ahead about this, and I'm probably right that Karen has some knowledge of this and probably
Sure.
has at least heard about it in some of the calls she's been on with the Quitline Consortium. But I will get back to you guys. I will, ask her a little bit, quiz her a bit, and see what I can find out for you.
Great, thank you.
Yep. Okay, well, thanks again, Paul.
Thank you. And hearing
forward to
no other
working with everybody.
questions, I will jump on to an update on where we're at with legislation at the Capitol and some other TFM programs. So for those of you that were at the conference that we held earlier this year online, Jared Burkhardt from the Michigan chapter of the American Pediatrics Association gave an update on a package of Senate bills that was introduced. TFM, Tobacco-Free Kids, American Cancer, American Lung, American Heart, and American Academy of Pediatrics have sort of been serving as the main force behind the Keeping My Kids Tobacco-Free Alliance, which Elaine mentioned earlier. The alliance itself consists of, I think, 60 plus organizations now, actually. And together we have made a number of very good changes to the bills since Jared talked. However, there have also been some not so good changes. So my intent here is just to give everybody sort of an update of where the bills are at and what we're looking at moving forward. So the bills were passed by the Senate Regulatory Reform Committee in June, and then the very next day the full Senate passed them after they had been sitting in the Reform Committee since about February. And now they are in the House Regulatory Reform Committee. The House had one hearing on the bills and then went into their summer break. They're back now, but the budget concerns are so much that it seems unlikely that they're going to pick this up until later in the fall at this point. And these will probably become a lame duck set of bills. So the package consists of six bills, 4 of which are sort of really the main ones. The first one is the tax bill. This is the biggest of them all. It introduces a new tax on the consumable materials portion of vaping products. It sets the rate at 18%, which is quite a bit lower than the wholesale on other tobacco products. Largely because a lot of the the belief that vaping products are safer and a way to quit is pretty prevalent at the Capitol, despite it not being in the Surgeon General's report and having no evidence thereof. And there's a lot of reliance on a 2012 study that really doesn't maintain a lot of relevance now. But we did get it up to 18%, which was lower than it was originally proposed at 10. The bill also fails to use a single definition for all tobacco products, which is something that it creates a bunch of sub-definitions of vaping materials versus vaping products. It's just really complex, unneeded, and it opens up the door for new novel products in the future that aren't subject to these bills, just like vaping products haven't been subject to the tobacco bill so far. This is something that we would like to get changed, but I really don't see the tobacco industry is pretty strong against it, and there's enough support in the legislature that it's unfortunately unlikely that that will change. There was also a provision introduced very late in the Senate process, right before it got passed, that raises the cigar tax rate, but it removes the sunset provision. Cigars are actually taxed are taxed by the cigar rather than by their wholesale price, like other tobacco. This raises the rate that they would be taxed at, but it removes the sunset, which means that after a number of years, as inflation goes up, the relative tax rate on cigars is going to drop down to, well, effectively nothing given enough time. So this is something that we're pretty strongly opposed to. Raising the rate is fine. Ideally, we would like it all just to be taxed as a single product, but at a minimum, a sunset needs to stay in place, in our opinion. 782 is the licensing portion. This is a bill that, as Jared talked about, was sort of a joke. It created a $25 licensing fee for stores with all, and it only covered vaping retailers. You didn't cover any other tobacco products. Since that time, it's been changed. It's not perfect. The licensing fee is now $100. And there's a $75 annual renewal fee. It also dedicates the money to enforcement and does cover all tobacco retailers. So overall, that's good. We think some higher licensing fees would be needed to actually fund the enforcement, but this is sort of in line with what most other states do, even if it is low. And it does cover all tobacco products, so we feel relatively good about the gains we've made there. 783, this is really the poison pill of the group. It has two main provisions. The first provision is it has limitations on advertising and promotions of vaping products, which are very vague and most likely will be challenged in court as First Amendment violations, putting the entire set of bills on hold. And the even worse part of that is the bill actually affirmatively allows any flavor of vaping products to be sold to those over 21. This creates a conflict with the federal legislation. It gets in the way of the governor's ability to create permanent rules. It is clearly intended to increase the targeting of vaping products to kids, which we know the flavors are very attractive to those. And the governor has said that she will veto the entire package if this bill remains in place. The way these bills are all set together, if all of them have to pass in order for any of them to pass. So this bill really does need to get changed. It's where we're putting most of our work. It seems like there is some give and take possible on this, but if these bills really do go down, it's going to be because of this particular provision. 784 is the one that supposedly covers enforcement. Jared talked quite a bit about sort of how there wasn't any, it was very poorly defined in the initial. We had worked with the senators to get a decent set of enforcements of a minimum number of mandates, a minimum number of checks of 1 per year in place. We'd been asking for 2 because Michigan leads the country in terms of no sales orders from the FDA, but it was at 1 a year. It also puts penalties on the retailers in addition to the store clerks. Again, we had been mandating to try to put all the penalties on the retailers. That was a political no sale, but we do now have enforcement penalties on retailers for repeat violations. And if you do have a violation, you get checked further more often. In that same set of bills that introduced the cigar tax revision, the rate check got changed from 1 check every year to 1 check every 2 years. So what was half of what we had been asked for got halved again. And given how bad our violation rates are in some parts of the state, that just seems criminally low. So we're working very hard to try to get this back up to, at a minimum, 1 per year, but really 1 every 2 years. There's also what we believe to be a pretty funny typo right now in the Senate bills because of the last minute nature of these changes. If a store is found in violation of selling to under 21, the second check is, as written, not allowed for at least 3 months. So it went from being rechecked within 3 months to no sooner than 3 months. I think we really think it's just a typo and it should get fixed, but it just sort of goes to show the very unfinished nature of this current legislation. And then 785 and 786, these are really just technical amendments to the penal code and some tax codes and age of majorities. There's really very little to talk about on these bills. They just sort of make all the others work. But there's a lot that still needs to happen. These bills, as I said, are probably headed towards lame duck, which is good because it gives us time to build support and educate the legislators on what the changes are. And I've got a few sort of actions that people can take. The first is have your organization join the Keeping My Kids Tobacco Free Alliance and TFM. Having numbers behind both of these organizations is very important. So if you're not a member already, please do. The Keeping My Kids Tobacco Free Alliance is no cost to organizations. TFM is pretty minimal. So please do consider that. The Alliance doesn't have individual members, but TFM does, as I mentioned earlier. The more members we have, the more we get listened to. So please do consider joining us. Watch my bi-monthly updates. I try to put in little updates about what's happening, especially when things are moving. because we don't have a lot of time on a lot of these things. When a committee meeting gets scheduled, we may only have 3 or 4 days notice. Jody Radke from Tobacco Free Kids also puts out a weekly update from the Alliance. So if you join the Alliance, you'll get that as well. Contact your local state house representatives, talk about the importance for having strong enforcement of these bills. And I totally missed it on my earlier thing, but and that is a really big oversight. One of the other major changes that occurred right before these bills left the Senate is money from the bill, from the taxes, got allocated to enforcement and local health departments at about $2.5 million per for the health departments and for enforcement. That is not sufficient. It's and then the rest of the money goes to the general fund. It's an improvement over the initial place where all of the money went to the general fund, but we really, especially as Elaine talked about earlier, we're pushing really hard to try to get all of this money to go towards the tobacco section. Michigan ranks 48th in the nation in terms of funding of our prevention and enforcement programs. So we really need to get that up, and this is a great opportunity to do that. So if we can get as much of this dedicated for our tobacco programming as possible, that is a major change. It's good that there's some, but again, we need more. But getting back to talking to your representatives about how important that need is, how that impacts you, how that impacts your community, how that impacts your organization, is something that can be really helpful both now and down the line when these do get voted on. As I mentioned, the committee held one hearing. I testified at the hearing. Jared from the Pediatrics Association testified as well, but really the strongest testimony came from a mother and teacher who talked about her personal experience with these bills. It's a really great way to educate if you have a personal story that you can share. And while the committee members, for everybody, were relatively checked out during the majority of the committee meeting, they really did pay attention to her. So if you have a story that you want to tell, do consider testifying to the committee when they do reconsider these bills, which again, I don't know when that will be, probably not for a few months at least. Although as soon as I say that, they'll schedule it for next week. We've got a couple people lined up already that responded to the updates for this, but the more the merrier. So if this is something that you're willing to talk about, please get in contact with me. The committee is also accepting Zoom testimony, so you don't even have to come down to Lansing. And then finally, this is sort of the easiest, but also one of the most valuable, is continue to post on social media about the dangers of vaping. Keep vaping aware and in the social spotlight. Before COVID, it was the top trending, one of the top trending items on social media and in the news. Since then, it has dropped way down because of COVID, for very good reason. COVID's obviously something that needs to be in everybody's awareness. But everything we can do to keep some of the spotlight on vaping, to force pressure on legislators to make this legislation strong, is important and valuable. So very quickly, I'll also talk about the flavor ban. This is separate from the legislation that's introduced, other than, as I said, 783 would prevent a flavor ban from being put in place. Last year, the governor put in place a ban on all flavored tobacco products except for tobacco flavored ones. It included menthol, included mint flavors. It covered online stores and in-store sales. It was effective for about 3 days before it was put on hold by court order, and has been on hold ever since. As an emergency rule, it lasted 6 months, could be extended another 6 months, but then it can't be extended again. So it's going to expire in September. Whether or not it actually will be put in place, again, nobody knows. There was just an appeal to the Michigan Supreme Court, where based on some other recent rulings, it seems like the governor has a pretty good chance of winning that appeal, which she should, in our opinion. But even so, it would only be in place for 2 months if the Supreme Court rules tomorrow, which they won't. So the more important part of this, in my opinion, is the governor is developing some permanent rules to ban these. They have not yet been announced. They are subject to a public hearing and comment period. So they're going to take some time to get in place, but there is still enough time that they can get in place before the end of September. So we expect these to be moving quickly, but I don't have the information on it right now. It will be in the TFM updates as it gets announced. So actions for this, again, this is sort of a get ready and wait. We are going to urge everybody to support the rules when they are submitted for public comment, assuming that they're similar to the emergency rule ban. There's also a potential to sign on as an organization to a amicus brief. That's a friend of the court brief to the Supreme Court. The Keeping My Kids Tobacco Free Alliance put one together for the Court of Appeals. I don't know if we're going to do it for the Supreme Court or not. Probably, I don't even know if the Supreme Court will accept them, given the hopefully expedited nature of the hearing. But if that is something, it's just another reason to make sure your organization is part of the alliance. And then finally, this is a new project that wasn't really around when we had our annual conference. Michigan's casinos. As many of you know, they were exempted from the smoke-free air law when it was passed a little bit over a decade ago. And our tribal casinos, which are the majority of the casinos in the state, aren't subject to state law. So they have been one of the main sources of public smoking places in the state for the last 10 years. One of the good things that COVID did is that when the tribes announced that they were reopening their casinos, the vast majority of them chose voluntarily to reopen smoke-free. Only 2 of them are currently permitting smoking. There's a couple that are permitting smoking only in designated areas, and everybody else is smoke-free. These are all listed as temporary measures, but they're really good temporary measures. So we're trying to celebrate and promote that. The Michigan Gaming Control Board also issued new minimum standards for the Detroit casinos when they reopened smoke-free, or when they reopened to reopen smoke-free. Again, this is a temporary order, but a good step to show that smoke-free casinos can be effective, which will hopefully help reduce the impact that secondhand smoke has on all of those employees So some actions we're urging people to take are to praise the tribal leaders for going smoke-free, whether that's on social media, in person, or at any other public forum that you're at. Really, this was a completely very voluntary step that they took. And whatever we can do to encourage them to continue on and transition these from temporary rules to permanent rules is something that we encourage everyone to do. We encourage anyone to go, if you're going to go to casinos yourself, you have friends, contacts, patients that are gamers, have them go to the smoke-free ones. Show that that money talks, and if we can go to the smoke-free ones, that is a positive thing to do. Also, TFM is trying to put together a alliance to push for permanent smoke-free Detroit casinos. This is going to be a joint effort that looks at working with the Detroit City Council, with the legislature, with the casinos themselves, with the unions, to try to make the casinos choose to make this go to the Detroit casinos to permanently reopen smoke-free as well. Just a couple reminders for those of you that joined late. Actually, I guess before I do my reminders, does anybody have any questions about the legislation, the flavor ban, or the casinos?
Paul, this is Lisa Danto.
Hi, Lisa.
On the hi, I turned the video off because my Wi-Fi is so bad. It kept disconnecting. Regarding the casinos, what I wanted to know is, as far as you know, or anybody else on the call, is that also going to include vaping inside their facilities?
I would have to check on each of the tribes, because each tribe has their own unique set of restrictions. I am unsure about that. I believe that the temporary order from the Gaming Control Board does include vaping. I know at least one of the casinos is mandating mask wearing, which would prevent vaping as well. So I don't have a clear answer for you. Maybe somebody else does, but I suspect the answer is it's going to be a mixed bag, case by case. Any other questions? So in that case, I will just skip to reminders. For those of you that joined late, please watch your mail for the membership renewals that will come out in probably early September. Our mini grant applications are now open. Go to our website, tobaccofreemichigan.org, to get those, and please consider putting in a project for an application. And if you're interested in running for the board, or even just joining a committee, please think about that and watch for the nominations to open in late August. Also, it looks like Heidi, you've got a question and you're having trouble unmuting. I apologize for that. The question is, how long will the casinos remain smoke-free? Nobody knows. It's up. Yeah, it's nobody put any dates associated with how long they're remaining smoke-free that I'm aware of. But everyone said that it was a temporary set of rules and policies that they're putting in place to respond to COVID. Hopefully that helps, even though it's a very evasive answer. Is there any effort to send a thank you from all of us to the casino? Yes, there is. TFM was working with the American Non-Smoking Rights Foundation to identify the casinos that were reopening smoke-free, and the foundation sent out a certificate of recognition to each of the casinos that did, that thanked them. TFM itself has not sent one out. It could be something that we consider doing going forward. I think it's probably again, the more that we have, the better. So.
Paul, this is Lisa. Do you know if A&R on their website, they used to track data for certain smoke-free policy groups, and I think years ago, I think they had maybe 1 or 2 casinos nationwide. Do you know if they've added any of these Michigan ones to their data they compile?
I know that they've added them to some data they've compiled because they were tracking the casinos as well. They had discovered a couple that we had missed, and we had discovered a number that they had missed. I don't know offhand if that's up on their website or not. I don't know if they're counting it as a permanent change, as a real change because of the temporary nature of it.
Well, at some point, might be helpful to send the link out, maybe in one of your newsletters if it's up to date,
Yeah,
and then others could share.
Yeah, so what I'm planning on doing is not in every update, but in every other, maybe every month and a half or 2 months, send out the full list of where every casino is at, so that people are aware. Because, as I mentioned, these are constantly changing. Nobody put any real deadlines on it, so yeah, I think having the list of which casinos where is going to be very helpful in the future. Any other questions? In that case, I will open the floor to anybody else that wants to share what your organizations are up to. I know the networking portion of these meetings is always very important and valuable, and something that people find useful when they're in person. So I just want to open the floor to any announcements from any of you for the rest of us.
Oh, this is Libby. I don't really have an announcement, but I just wanted to thank you and Elaine for the great updates. I really miss these meetings, so it's nice to be able to get it all in one place. So thank you both very much. Appreciate it.
Thank you. And thank you for the thumbs up there, Cliff.
My pleasure.
So hearing nothing else, again, I would just like to echo Libby and thank you, Elaine, for your update. I think it was very helpful. I think it's going to be sounds like there's a lot of changes that are going to be happening with you guys, and it's good to know that. So we wish you the best of luck, and hopefully we can help you all through the process as a community, because the work that you do is really important. So thank you everybody for coming. The next meeting will be in October.